Good morning, everyone. My name is Will Sauls. I'm the Division Director at Brooklyn Community Services, and I co-chaired alongside with Deborah Grive, the Family Provider and Care Management Information Committee. This committee is a subcommittee under our Brooklyn DD Council. Welcome, everyone. Happy New Year. It is great to see all of you. And I am going to pass the mic to Debbie for a quick introduction.
Good morning, everyone. Happy New Year. I am Deborah Greif. I am the co-chair. I'm also a parent, as you all know, of Mr. Christopher Greif. And yes, I do chair the Brooklyn Family Support Service Advisory Council, but today I am co-chair of this committee with Rose Saul, and I appreciate everyone being here. So thank you so much. And now I'm turning it back over to Rose.
So as you all know, you all have been on this call with us, and if you are new to the Family Provider Information Committee, we collaborate every second Wednesday of the month and trying to bring information to family as well as to provider. We are always looking, and the care managers, we are always looking for topics of interest because we want to make this meeting very productive. So any, ideas, topics, subject matters that you would like us to bring, and this is a great place to bring them. And then if you have any speakers in mind that you know of, anyone that I can reach out to, I'm happy to reach out to the speakers and have them come and do presentation for us. This is a really great committee, right? There's a lot going on, a lot of changes and legislation is happening, policies, and we want to keep you abreast. Anything that's happening with the CCOs, we want to keep all of you abreast. But today, Debbie, do you want to do any housekeeping? I, I know you
Sure.
had it.
I'll do as best as I can. Okay. All right. Right now, we're asking anybody who has announcements to please put it into the chat. Also, we're asking that please wait to be called on. If you're here by phone, it's, I believe, *6 to raise your hand. But if you're not on the phone, because I see everybody here is through the computer, so there is a reaction piece where you can raise your hand, and then we will call either Rose or I will call on you. Let's all be respectful of each other, and also please be aware we are recording this meeting. It is important because we do have very valuable, important information, and I thank everybody that participates and come to the meeting. If there's anything I missed, I'll probably get a click on by Mr. Greif, but right now he's at another meeting. So it's
No, you're fine.
thank you very much. I'm glad.
He's still watching.
He's watching. You see, he's there. You see where you see the circle? That's him. But he's watching. But I know I've been clicking the buttons correctly.
No, you
So
did great, Deb.
here,
Thank
so
you.
now, welcome. Now, but there's only one thing. Can I just mention, Rose, really quick? I just want everybody to know that due the advisory council, there are subcommittees on the state on our family support, where one of them is we're doing the ADM on reimbursement because of the allowable and non-allowable list. Now, I'm going to ask everybody here who's had issues with it. I know when you talk to Angela Blake, she's reimbursement for New York, for Brooklyn. That's correct to let her know. But also let me know about, so in the piece, my piece is the advocacy role. We're trying very hard to get more stuff off the non-allowable to the allowable. It's not going to happen right away because it's called justification too. As you know, when you fill out the papers, you have, besides it has to be helping the child's developmental stability, but also it has to have a good justification letter. Also, I ask all the care managers here, please let us know, the advisory, if you're having issues with that. And also, please, because I do sit on reviews with the agencies that do have a reimbursement program, we are trying to keep the reimbursement program for family support. It's one of the best programs and it was the first that was started as a test pilot when family support was started. So let's see what we can do. I am not guaranteeing, but the more I have correct facts, the easier it is to advocate, to get one thing off one list to another. So that's all I'm asking. And now I'm turning it back to Rose. And I see we have a new person in, Mr. Thompson. Please, we see you're here. Thanks very much. Okay, Rose.
Yes. So today we have a great speaker from Care Design New York, Mary Alice Sanchez. She's the Director of Care Management at Care Design, my former colleague from Brooklyn Community Services. Happy to have her on the call, and she's going to give us some updates on services and care design with the care management, any updates, and as well as trainings and stuff that is happening at Care Design. Mary Alice, we are happy to have you. You have the floor. Welcome.
Good morning. Thank you. Happy New Year's to everyone. Rose and Debbie, I don't have access to share my screen. I do have a PowerPoint I wanted to share. It's locked on my end.
One moment.
No problem.
Chris, I'm going to have to, let's see if Chris hears us.
Yes,
Christopher.
I do, and I'm ready working.
Thank you.
Okay,
Yes, I can share now. Thank you. Thank you.
Just one thing, just to remind anyone who's going to be speaking, I do need to know ahead of time so I can then be ready quicker.
What he's saying is,
Thank you.
any speakers here, or for now and today and in the future, if you are going to speak at this committee meeting, can you please let Rose and myself know so that you will have a PowerPoint so we can make it so much easier and smoother for you. That's what he's saying. Thank you. Okay.
For the record.
All right. So now you have the ability now to share.
Yes. Thank you. Thank you. Chris, I have the availability. Let me. Give me a second. Do you guys see it?
Yes.
Yes, we do.
Okay. Do you see it from the beginning?
We did before, but now you just switch over to. Okay, it's coming up. Roles and responsibility of a care manager.
Yes. Okay. Yeah. Perfect. Okay, so I wanted to just first do an overview regarding the roles of responsibility that we have as a care manager in someone's life, and also give an insight for families and providers of supports that care managers have at Care Design, because I know you guys have a lot of questions as to like certain things similar to what Debbie was talking about, family reimbursement, how are care managers supported throughout that process with those changes that OPWD does. So thank you very much for having me. I am one of 4 care managers director at Brooklyn region at Care Design New York. My name is Mary Alice Sanchez. And is care management a good idea? It's actually the beginning to all services. It's what leads to other services. It is the one place to start. If you have a care manager, you have access to the following services. You can have access to respite, to recreational, to community rehabilitation, to self-direction, to family reimbursement, to rehabilitation services. That's more for adult services, vocational training services, residential placement, etc. So that's where we are like the start of all, or the beginning of all the services that you have access to through OPWDD. The care manager focuses on a person-centered planning and is there to assist with various things of the individual's life. It's not only limited to those OPWD services, we also do assist now through Health Home medical services as well. We provide assistance with medical appointments, connecting you with providers, contacting health insurance, and specialists as you may need. The enrollment process, you first need to have Medicaid and OPWD eligibility. That's where it starts. Then we need to submit to OPWD certain requirements. The evaluations the first one is psychological. It has to be good within 3 years. It has to include an IQ testing to that psychological. The psychosocial has to be within a year. And the psychosocial evaluation is a short, biography of the person, the developmental history of the person, the family dynamics, the home environment, and that one unfortunately does have to be within a year. The annual an annual medical, an annual physical form also, and it has to be within a year. When you come into Care Design to a CCO, you're going to be assigned to an enrollment specialist, and they will be helping you, providing you guidances with respect to anything. If you come in and you don't have Medicaid, they will help you with that. If you don't have opioid eligibility, they will help you with that. Connecting you to providers that can do the evaluations as well. All of that, the enrollment specialist is the one. The families don't have to worry about submitting those paperwork to OPWD or following up. The enrollment specialist is the one that applies to OPWD. It does it electronically, so you do get a faster response, works with the family in getting attestation and consent that you are giving us the right to advocate on your behalf to obtain those services. We do offer 2 plans. We have what is called a health home care management. That is the majority of the members at Care Design, but we also do offer basic. Basic plan support just does 2 things, which is monitors your health and safety. So if there's an urgency, something that is an emergency, and you need your care manager to intervene, you can contact that. But what basic really does is just the overview of the plan, making sure that we keep your life plan, your annual life plan up to date and your semi-annual up to date with regards to any supports that you may have. The health home care management is the most comprehensive one. That it's the one that the majority of our members do enroll and monitors your health and safety. We do develop your plan and monitor and make sure that they're compliant, but it also access to behavioral health services. We're responsible for coordinating those services, responsible for coordinating your medical and dental services, anything that has to do with preventative. As you know, or may not, people with disabilities sometimes have fears with dental, don't see the dentist unless they're receiving pain. We educate the families, we locate dentists that actually can be suitable to your diagnosis and you feel comfortable and have sensory availability for people that do have, certain fears with dentals and medical. We identify community-based resources. We use technology to link you to services through choices, through reviewing it with providers directly. We connect you with providers. Care managers have access to the listing of providers between the boroughs. We contact them. We find out if there's availability, if they do have staffing, which is usually the challenges that we have. We connect you to help you navigate the systems for family and individual supports and anticipate future needs. So if we have a member, for example, that we're reviewing and we're contacting constantly, the family's getting older, the parents are the only one that's supported, we do talk about future needs and help the families plan, for those necessities in the future. So the role of the care manager is to advocate for the member regarding their health and wellness, facilitate the life plan development, as I mentioned before, apply to waiver services, educate the families on what services are out there. Some families come in already knowing what they want and what services they feel like they need. There are others that do not know, and is our role to apply and educate them for that. Collaborate with providers. Sometimes providers are the ones that communicate with the care managers regarding certain concerns that they have or barriers that they're seeking. Maintain a comprehensive record, and that has to do with the fact that an IM assessment has to happen every single year, and it has to happen at least 30 days before the annual life plan. That is the person-centered assessment that was designed by OPWDD for care managers to use. Not all CCOs use it. In Care Design, we still use the IM assessment, and that is where it develops the goals into the life plan that are assigned to the providers. We are responsible of monthly contact and communication, at a minimum of monthly contact, not that we only speak to them monthly, but at least a minimum of contact and communication. Problem solve when a crisis arises, coming up with solutions, knowing what are the necessary follow-ups, and communicate with OPWD regarding projects. If you, by any chance, are enrolled in Care Design and you find yourself with some enrollment challenges, these are the contacts. Again, the enrollment specialist will provide you linkage to family support services and others systems in care, assist you with appointments for the evaluations, as I mentioned before, assisting you with Medicaid application, any other paperwork that you need so that you're able to be approved for those services, and start the waiver enrollment. We don't need to wait until you're enrolled at CareDesign. Majority of the time, if you're new to waiver services, the enrollment specialist will begin the enrollment process. The telephone number for enrollment is 518-235-1888, and I'm leaving it there. We do have enrollment at caredesigny.org. That's the contact. Luz Obando is the intake specialist assigned to the Brooklyn region, but you can contact Peter Coleman. He is the manager for engagement, outreach and engagement, or herself, or use the enrollment email that is there. And I can provide that later, and Rose can share it, or Debbie, with everyone that has joined. Upon enrollment or following enrollment, what happens, to the person? We are mandated to review with you a checklist, a care management checklist that tells you what is exactly the expectation from us. So in our initial contact, we tell you this is what we're going to do. We schedule with you the IM assessment that has to take place within 30 days of enrollment. From at the IM assessment, we then schedule the life plan meeting that we have 60 days to hold from enrollment and have it published at least no later than 90 days. All of that is needed for that waiver packet, for those information, and life plan in process is accepted by OPWDD, so it doesn't have to be finalized, which is really good. We're able to highlight there which are the needs and the services that the person is requesting, and include their justifications as well. So that OPWDD can begin, sooner than later, those services. You can expect from us to continue or initiate waiver enrollments. We do get transfers from other CCOs or people that moved like downstate, they're no longer in a catchment area of their CCO of their choice. And we're able to also continue those waiver services, transfer the waiver to the new region, and locate providers that can, so that there's no barriers to their care. At CareDesign New York, we do, and I'm going to go a little bit more about that in a few minutes, we do assign the case to a permanent care manager after 90 days. I'm going to explain to you why we don't do that sometimes at the initial assignment. What to expect for a care manager during the process, as I explained, complete an IM assessment within 30 days of enrollment. That's one of the requirements. Also, we keep and complete a DDP2, which that determines certain scores that will eventually tell OPWDD how much need is needed, how many hours they can approve for programs such as respite or community hab. We do that every 2 years moving forward, or if there's changes in diagnosis or changes in the person's life. Someone that can actually ambulate on their own and now they were going through a surgery and they can't. We do update it. We don't need to wait for 2 years to do that. We do the LCD redetermination. At CareDesign, we do it at the 11-month cycle. So we do it a month before that is due to make sure that the level of care redetermination is done in a timely fashion. And we also communicate with Maximus with regards to the CAS, because without having an updated CAS, we are not able to obtain new services. So that we do, we review the CAS, we inform them if there's changes in diagnosis too, if there's a need for a reassessment, if the CAS is expiring or expired and the person wants new services, we're required by OPWDD to initiate that request for the CAS to be reassessed. So during the life plan process, the care manager is responsible of gathering the entire team, including providers and families and people that are important for the person. Having that one invite, the care manager has to be in person with the individual. Providers can join virtually. So the care manager is the one that initiates that invitation. It says there will be present at the life plan meeting with the individual, so face to face. We are also responsible of making sure that the staff action plans match the life plan, self-direction budget, makes sense, review all those things at the meeting. The team themselves discuss the goals and agree from that IM assessment, those goals that are at the life plan. These are the ones that the DAHAB is going to be working on. These are the ones that can be assigned for safety, for the respite to be made aware, and things like that. At the semi-annual, We also are responsible of reviewing that plan. There's no assessment for the semi-annual, but we will do the same thing, which is convene the IDT, ask everyone to join. The care manager, again, has to be in person. You can expect the draft of the life plan to be sent by the care manager no later than at least a week prior to that meeting. The care manager may bring copies, but we will send it out because it's important that you see that plan as a provider and as a family. You see it in advance and look for those changes that you're going to be asking at the life plan meeting. That is the time in which we really want to have those conversations, not when we're near publishing it, because it's not where we had a person-centered meeting with everyone included. If no edits is needed and is approved, then we will try to get from you, from the family members, the person who signed consent, from the direct advocate or the individual, a signed, physically signed attestation, we call it, or it can be an email response, or it can be electronically signed as well. For the providers, what we seek is acknowledgement. The provider receives the plan that is right before publish, and the providers can respond to the email or sign the attestation themselves, stating that they're okay with what is being said in the life plan. There's no changes, but it's the acknowledgement. They don't have to like physically, attest to the life plan, just the family and the member. Or the member. We are responsible in aligning the life plan to the staff action plan. We review the levels of supervision, the goals, the tasks that need to be assigned to staff, the supports that may be assigned to providers following the comprehensive assessment. And that is reviewed and make sure that everyone is in agreement to it. The POMs and goals in the life plans are general language, where it's very general. We do expect the staff action plan to have a more detail to that person, but it's not a billing issue. And I know some providers do want us to make certain changes, but the wording of it is very general when it comes to us, and that's how it should remain. The life plan should be reviewed with the staff action plans. It should be held early to avoid any discrepancies, because after we publish it, then it will require an addendum, which may or may not, depending on the changes, require another meeting, which is why we want you to see that draft prior to. We're also responsible, like I said, for applying for waiver services, self-direction services included. OPWD authorizes the services, but we are responsible of submitting all the paperwork. The life plan is needed to apply to services. The life plan should highlight, at least in the introducing me of the narrative, the justification as to why these services are being requested and needed for that person. They're important for them. Although a justification letter is separate with more details into it, there has to be at least that, those few sentences explaining as to why that new services is needed for them. The care manager contacts providers that deliver the desired services to find out if they have, to see if the families are okay with them. The care manager is responsible to collaborate with the justification and the SART and the RSA to get services that are authorized. So we do the request, that is the service request form. For someone that is new to waiver, as a new enrollee, we do have to request for services access. That's the RSA. For someone that is already enrolled in the waiver and is looking to make changes, then we do what is called a service amendment request tool. If a member already gets services, they want to change or add the new services and hours, the care manager will complete a SART form. And I'm going to go over about the supports that care managers do receive at Care Design with regards to those things. Once the NOD is, which is the notice of decision, it's approved and the letter is received, to us via Choices. It's uploaded by OPWD. We are responsible communicating with, the families do receive a copy, but we're responsible of communicating, making sure that they have received it and letting know providers that we do have the approval so that now they can do the enrollment to those services. Any changes to services need to be reflected in the life plan as well and will require an addendum. I can't see if there's any questions, so I'm going through it very quickly. So if Rose or Debbie, if you guys want to unmute and ask, or should we leave the questions to the end?
No,
Leave questions to the end. Go ahead.
we want to leave the questions to the end. I am watching. No one's raised their hand yet.
Sounds good. Thank you very much. I appreciate that. What to expect from a care manager regarding visits and communication. So like I mentioned before, we do have the requirement of at least monthly contacts. We can choose to contact the provider and making sure that the person is making progress with their goals, contact the family and review how they're satisfied, how they're doing, review those preventative cares, such as, hey, your annual physical, you did it last January. Do you have an appointment to now? Let me get you an appointment. Someone that is new, if you didn't like that doctor, making those changes. But we also have, as care managers, face-to-faces or in-person requirements. So at Care Design New York, no, OPWD requires us to see people twice a year, the minimum. This is after COVID. They realized that telehealth is something that was working and families are able to opt into telehealth. So we have to see our members at least twice a year. The first visit has to happen between the first half of the year, meaning from January to June, there has to be at least one visit. And from July to December, the second visit has to happen. This is OPWD requirement. At Care Design, we have determined that we will do that at the annual life plan meeting and at the semi-annual life plan meeting, which tend to happen between either the first half or the second half of the year. That is a requirement for everyone that are health homes. If the member or the family agrees to telehealth, then we can solidify or consolidate the other face-to-faces with regards to use of Vonage or Teams. Those are two approved matters in which we can do telehealth at Care Design. They're HIPAA approved, meaning they're not going to sell information or contact information. It's safe for us to do that. It does not need to be in the same room or space, but it needs to have a video, meaning similar to right now, if your camera's on, my camera's on, you're able to see my face, those can be done. And those are done at the other quarters. So just to give a little care manager math, I call it, if the annual life plan meeting for me, Mary Ellis, is in January, that is my in-person. That means that the second quarter that starts in April, May, and June, I can have a telehealth. And I can choose to say, hey, I want to do it on Teams. It's very easy. Or Vonage, which is also very easy. And we teach the families. That is if the member actually is in agreement. We have families that do not like telehealth. They do not like, virtual capabilities. And we do see them, every quarter. Opting into or out flexibility, members may choose to leverage that can be a combination of less frequent face-to-faces and receiving some visits through telehealth contacts. Allowable options are based upon the tier of the member. So in care management, we work with people, customer services we do have, and you have access through member relations, direct and live access via phone or email to someone. Doesn't have to be that care manager. If you have any concerns or complaints or things that you want to resolve or questions that you may have, they will provide you with the information. They will connect you if they need to speak to the care manager team, and they will follow up on your behalf. It's open for members and providers and anyone who needs to connect. It operates Monday through Friday from 9 to 5. And I have there the telephone number as well as the member feedback at Care Design that you're able to contact directly. It's done through the ticketing system. They do track it. They make sure that you do get an answer to your concern that was raised, a resolution to your concern, and an answer to your question. I know that a lot of family members sometimes just have the contact of the care manager. So we do give them this at the enrollment packet, all of this information so that they have it from the beginning. In the event they don't feel comfortable, they should feel okay contacting at least someone at Care Design with regarding to their questions or concerns. We do have translation services. We're able to support people in Brooklyn. This is information regarding Brooklyn. A lot of Russian, speaking Spanish, Yiddish, Korean, Creole, Mandarin, Cantonese, all of that is there. And there is translation services for the enrollment because the enrollment specialists may not speak those languages. But we do have care managers that are able to support you in that as well after you're enrolled. So you can reassure that member relations is where you can have access to a peer support, someone also who's enrolled at Care Design that works for the member relations that can relate to you if you do need to speak to someone like that. You have a staff that are similar experience navigating services and offer unique perspective to members and families. They are knowledgeable about OPWD services. They can educate you regarding resources in the community if those are the questions that you may have. And that is their contact there. And we do have an after hours in the event your question cannot wait until Monday or the next day at 9 a.m. You have that. We do have, which is within the same department, provider relations. So that is strictly a contact that we don't advise family members to contact. It should be for providers that are having a hard time communicating with care managers, or they have, we've worked with providers that have lists of like documents that they need or service gaps that have been identified. Provider relations is the team that works with agencies collecting what are the services that agencies are providing. If they actually inform care management through a monthly training that they do of new providers that want to be highlighted there, that go over the services. They also actually let us know if there's like vacancies or a new program starting, like a new ISS department, provider that has like 17 apartments, so that the care managers are constantly informed of that. That is their way for providers to speak directly. They promote proactive communication, regular connections with care management, and they explore collective support members and families. We have a SharePoint page where it shares providers and it tells us what programs those agencies and providers have, so that care managers know who to contact and find out if they are staffing for ComHab. We are able to see that. And provider relation is what collects that information. This is the contact for provider relations. Our contact person is Bridget Verkel, and that is the provider relations at Care Design email inbox. And I recommend any providers that are here that want to communicate with care management at Care Design, that will be the go-to email. And I'll leave it there for a few minutes so you guys can jot it down. Care Design does offer quarterly webinars, and that is a link to our website. Families are more than welcome and providers to click and join. They do sometimes cover specific topics regarding the quarters, but if you're looking to know a little bit more about services that are out there and you want to be informed before you enrolled, you're unsure, I do recommend families to join those quarterly webinars. Usually it's done by an enrollment specialist, and depending on the topic, they will invite whoever it is to go over. And that's locally for Care Design, from Care Design staff. Additional support is Melissa Giuffra is the Brooklyn Regional Director. That is her contact. Most likely it will be a care manager under her team. She's my supervisor. Our emails at Care Design, when we send drafts, when we contact providers, when we send emails to families, do have also, if you notice on our signature, it would have my information, my contact, my telephone number, and it would also have my supervisor. So I do recommend today any providers and families to use that signature, because if the care manager is not getting back to you, hopefully they are, but if they're not, then you can see right then and there the supervisor's email. If you're having any issues and you don't want to go through maybe member relations or provider relations, use that. So I wanted to highlight that here. If you have any managed care questions, that is the telephone number and also the inbox email, managed care questions at caredesignny.org. And I'm getting towards the end. These are additional support to care management, and I wanted to express that here so that you guys sort of have an idea what kind of support care managers get. We do have a benefits and entitlement team. We have a staff assigned to our region. That regional staff through a ticketing system is able to answer us when a family receives a letter that the care manager doesn't know what really Social Security is asking. Why Medicaid did not approve of this? Why is it giving us a hard time? What are the next steps? We're able to get complete direct access. You guys have all met Irene. She's one of the supervisors for the benefits and entitlement, and we do have that. They offer also office hours where we can join and there ask questions or learn something new. We learn about recertification and how it changed after COVID, how we have to do that and what is needed so that the person doesn't have to go through the recertification process. This is to help support care managers and assist families in making sure that we do the due diligence on our end regarding their benefits increase to those families. The training department outside, we're required by the state to do at least seven trainings every single year. That is about Social Security, Medicaid, Medicare, SSI, SNAP, liability. All of those things are required by us. But OPWD does require that from us, and we do have to be in compliance and do that. But we do have a training department, and they do what is called Thursday lessons. It's every single week, and it's on subject matters such as quality improvement, new OPWD implementations. They go over it. Even though OPWD does their training, we do at the Thursday lesson review those implementations and go over how at Care Design we were going to be handling that project. They do related topics that are not limited, but they are regarding family reimbursement, which are very important for families, advanced directives, e-mods, etc. Endless. It's every Thursday. It's usually at 1 or at 2 on Thursdays that we have that. And that is done by the training department. And care managers also can recommend lessons and say, hey, I'm struggling with this. And then they'll add that on a Thursday lesson. It gets recorded. So if a care manager happens to be in a meeting on a Thursday from 1 to 2, it gets recorded, and the care managers, we have direct access to make it up. If I'm out on this Thursday and I'm going to miss this Thursday lesson, I'm able to rewatch it on Friday when I come back to work. So that's really nice and cool. And it's, like I said, it's topics such as quality improvement or new OPWD implementation to keep making sure that the care manager, is kept updated regarding those things. Service access is very important for care managers because that is our role, to connect families to services. Every region at Care Design has at least 2 contact person for service access. We have at least 2 in Brooklyn region, 2 monthly office hours. We have one that is held at the beginning of the month, and we have one that is held towards the end of the month. We have guides with pictures on how services have to be requested. At those office hours, we go over justifications. We review supportive documents that are needed. We let the care manager know, no, this is not strong enough. These are things that you need to add. We collect data from choices of things that have been submitted and needs follow up, and we find out what is the barrier. What is holding back that care manager from doing it? Is it a CAS that needs to be expedited and requested so that SART can be submitted, so that services can be approved, or if it was denied, what else can we do in support of that family to make sure that we do that? And that, like I said, per region is 2 contact person. We have office hours that happen twice a month regarding that. So care managers are not left out in the air when services are being, denied or requested, or sometimes OPWD asks for more information. Before it is submitted, the requirement at Care Design is that your supervisor reviews it, so that supervisor gives you the green light of yes, it looks good, pretty good, so that we make sure that we are, getting those services approved and our members are accessing those services that they need. Another support that care managers have is we have what is called regional rounds. It happens bi-weekly, and it's a way in which we can present cases that have challenges, barriers to services, some of them, are having some health conditions that need to be reviewed. We seek guidance from the healthcare team, whether from a medical professional or a mental health professional, and they do guide us. We have members that are in crisis, that are in need of residences, and we have to raise it up. That is a way in which we do that, on a private way that we do that. And we hear from everyone in the region and also from the specialists and the healthcare team. We also present on cases that have to do with forensics, people that have been involved, have been accused of crimes and things like that, and how we can navigate that and help them support during this time in family of crisis. So that is also an additional support that care managers have. You not just have your supervisor and your director helping you, but you have a group of specialists in the region that get to hear you present as a care manager, bring up what are the challenges and what exactly is that you're looking for to support, and we receive direct guidance that help us follow up with them the right way. And that is the end of my presentation. Any question that you may have? I'm gonna stop sharing because I don't see you guys. I'm gonna stop sharing.
No, I can
And go
see.
back. And now I see you guys. So any
Okay, hi.
question?
Marilee, I'm going to ask you this first.
Sure.
Okay. Since I'm saying it this way, since we do record the meeting, people will be able to, and we save it, they'll be able to see it on the YouTube page that the Advisory Council and the DD Council has. But we were asked if we could email the slides, the presentation.
Oh,
So,
sure.
yeah.
I can do that. Let me write it down. Yeah.
Okay.
I'll email it to you, Debbie, and to Rose, and you guys can distribute it.
I did respond to that question, Deb. I saw someone put it in the chat, and I did respond. I will email the slides out to them as well.
Well, after we get it. And also,
Correct, of course, after we get it.
Yes, after we get it. And we have to make sure that, and also the person who asked for it, Kia, we need your full email. I can't just send it to you the way you're asking. Anybody who wants information from either Rose or myself, in your chat, you need to leave me your full email address with your name. I cannot and will not email to someone who just says Kia or another or Pat or someone, and I'm singling anybody out, or Deborah. I really need the full name and email address. Because if not, I cannot and will not do that. All right.
And excuse me, this is Chris. As I said, this always in the beginning. This is to remind everyone, when you guys come in to the meeting, we do ask you to please put your name and your email address and your announcements. But as a remind you, it's very important to please make sure. The DD Council does send out a mailing out list, and they do keep track of people. But please make it clear, if your emails or you have moved somewhere and someone else is taking over, you need to let Brian Rothstein know, the chair of the DD Council. And I think Rochelle will agree with me on that one as well. I thought I saw her. It's just so many. Oh, I see her.
Yeah, she's here.
No, I see her. But I'm just making it very clear. Thank you. Any questions for the speaker?
Yes, you did a fantastic job, and I'm going to use it. I have a few, but I'll condense them. The first one is are you, Marilee, letting the care managers know that there are two councils, that many of the families who need to understand family support services should be advised to come to our meetings virtually, as well as, of course, the DD Council?
Yes, we do. Yes, we do and we do have family members that come in and they want to be involved, and they come in probably already, they had joined you guys first and they come to Care Design. So yes, we do share that. Our care managers, not that I share directly with families, but the care managers for sure.
Yeah, also because I would like you to please remind your care managers that there are in New York City, there's 19 advisory councils across the state and a lot in your catchment area. Please remind them that, because it's I've had parents tell me, the care manager says, I'm not important, I don't exist. And
the care managers are saying this, you're saying, Debbie?
Yes, I am. Not very nice, is it?
Let's just say it's not the one who's here. It's just
going around
to other places. Thank you, Chris. No, my heart dropped.
Yes, let's clarify.
My heart dropped when I heard
that. No,
it
doesn't matter, because honestly, I have also found that maybe, I'm going to say it this way, the families may not always understand either.
Mm-hmm.
But what I'm asking you is I'm not going to signal any other of the care managers. I'm just asking you to please remind them that in Brooklyn, New York City has two councils. Outside New York, it's usually advisory, because it's very important about that. And I do but the other question I have is, like, say, the individual only wants the most minute services from Care Design, they are that would be fine with them. Your agency too, right?
Say that again. They
Some,
want
it,
what kind of services?
some of the families, their children, like only having minimum service.
Services. Yes. Yes.
Minimum. Or so because many of them have their own doctors who have had long relationships with, and
Yeah.
they want to go away from them.
Yes, that is fine. They can choose to enroll on the basic plan, which is the most minimum requirement from us. And even through the basic, if a crisis happens, they should be able to contact their care manager. Care manager will not say, "Hey, we only do the life plan meeting annually and semi-annually," and then choose to enroll to Health Home when they feel fit that they need more support. Yeah.
Thank you. Glad to hear that. It's, I know a lot of individuals who tell me they only need the basics. I said, fine, I'll ask them. Thank you for that answer.
Yeah.
Does
Ms.
any-
Rife, we do have 2 hands up. I just want to make clear that Rochelle, the vice chair of the DD Council, has her hand up.
Hi, Rochelle, you ready?
Hi. No, I'll wait for other people to ask their questions first because mine is very particular. So
Oh. Okay,
All
then
right,
then we'll put
if
you.
there
I'll
are
have
other
you where
people
you are.
waiting, I don't know.
who's the
Um,
other one?
It's KILA, whatever, because his hand is up.
Kia.
That's the,
Kia.
I'm a parent, so I do have good
Sorry.
experience with care design. I just started the process. I knew that it would take, a while for it to happen, but I started with Luz, so her communication was great. Then I find when we got to the waiver part, we worked together because I was denied, and we did work together. And I try to give as much information as possible so that she can submit a new justification letter. We went through that together. I submitted as much as I could to build a better case of a need for my son, and the waiver was approved and in this December. So we submitted everything. I did it. Alicia, we went through once it was approved. We did the Medicaid application with Alicia, and we did it. She submitted it in December. We got right before Christmas the approval. So I just wanted to know from there what is the next step with care design.
Kia, were you informed if you were enrolled in January?
I would have to check. I'm not sure.
Okay. Okay. So that will be the first question. I will start with Luz since she's your contact person. Maybe it's February because OPWD has to approve the consent and let you know the green light and go ahead. Just so that you know, once you are told that you have enrolled with Care Design, we do the assignment to what is called a regional team leader. So you're not getting assigned to someone that we just hired that is new also to services and learning ed. For those first 90 days, you're assigned to someone that is experienced. A care manager has been more than like 5 or 10 years at OPWD. So those beginning assessments, life plans, requests for services, locating providers that have availability or finding out self-direction, brokers, it's done by someone that is a regional team leader. After the 33 months, the 90 days, it is assigned to a permanent care manager, but it's just following on supports. We have already done every legwork of obtaining that at first so that you know what to expect. There are certain instances that we do assign it to a care manager, especially if they have like a language need. Like why give it an RTL when we have a family, for example, that needs a Bengali care manager. So that is assigned directly, or a Cantonese care manager, Cantonese speaking care manager. So of course we do those assignments, just so that you're aware. Okay.
Sorry, I didn't get the date. I was writing notes. How many days would I be assigned a care manager?
I don't know if the enrollment went through.
Okay.
So what I can do, Kia, you can either contact Luz. I can write on the chat my email, and you can contact me, and I can let you know if your child enrolled in January.
Yeah,
and who's
Alicia did say that she forwarded the information to Luz, so she did send it over to her.
The fact that today is day 8th, I can tell you this: we have 7 days from enrollment to getting contact with the families and letting you know. So I'm thinking that maybe the child was not enrolled as of effective January. But I'm going to put my email
Okay.
here so that you don't have any issue, and you can contact me or choose to contact Luz. Okay.
No problem. Thank you.
Okay, Kia, I just want to add something. This is Deborah Greif. It takes sometimes longer to get enrolled into the waiver, and also I want you to understand it's not the typical Medicaid that your child's being enrolled in, because a lot of times parents make the biggest mistake about going to what I call the offices out in the community. The one you would need to go to is, I believe it's 785 Atlantic Avenue, but that is the one, because your child has development abilities, and that's where the waiver program, Medicaid waiver program, is controlled and worked on. And also, I always tell families, if you're having trouble with Medicaid directly, if you and your care manager go to that office only. Only, do not go to the others.
Thank you so much, Deborah.
Seriously. Okay?
I wrote
Because
it
if you go
down.
to the wrong one, you're not going to get the help. You're not going to get the right help. They don't understand. They'll tell you need to do spend down. You do not do spend downs.
Yeah, I think a
Okay?
lot of parents go
And
to
one-
the Claremont.
Yes,
It is
that's the one.
Claremont, but it's also,
Yeah, that
but
is
it's
it.
also Atlantic Avenue. It's
Atlantic.
the same
Oh,
It
area.
is. It's the same office. Okay.
Rose, and then me, and then
Rochelle
Rochelle.
has been waiting patiently. I'm going to be quick
No,
though.
she's the one who asked to go. She asked everybody else to go ahead. So
No, I
Well, I
know.
did want to hear what Kia had to say, actually,
Yeah.
See,
in
so
particular.
you want to go now, Rochelle?
Yeah, let me just raise something. First of all,
excellent.
Mary Elise, I want to thank you because I think you did really excellent and detailed presentation about the role of the care manager, which has expanded so much over the last 5 years. In addition to being the vice chair of the family vice chair of the council, I'm also a co-chair of the Family Advisory Board of Care Design and on the Board of Managers. So I've been involved with Care Design since the beginning. And I think people need to appreciate a little bit that every single day OPWDD is giving another responsibility to the care managers. And they are quite onerous and time consuming. And, becomes a bit overwhelming, I think, for most care managers, especially when there's still a shortage. And the shortage is felt more downstate, I know, within Care Design, particularly in Brooklyn and Queens. So I'm trying to put in context that the care managers, I believe, are striving to meet all their responsibilities as best they can. But a lot of things that are being expected of them from OPWDD are very time consuming and not really directly helpful to members and families, in my opinion. And I see Mary Lee's shaking.
I am saying thank you and thank you and thank you, Rochelle, because it is challenging. The staffing has been challenging, and like I explained, that's why we should do our best for new enrollments to give it to an experienced care manager so that the new hire, it's learning the process and getting to know that. So I do thank you, and yes, it is true, which is why I wanted to highlight at the end the support that care managers receive, because we do, like, for example, MSC days, when we requested for something, we were approved. Now it's constantly a fight back and forth, making sure all documents are in place. So we do that due diligence so that at least the services are getting, approved as soon as possible. So thank you.
I guess the other thing I wanted to say is that some improvements have been made with OPW implementing more electronic and digital exchange of documents, which has expedited things like service authorizations. But one of the things that has slowed down service authorizations is the need for a current CAS assessment. And for those who are not familiar, that is the official assessment that OPW is using now, implemented by an assessor from an outside agency called Optimus, that is supposed to reveal what the service needs of the individual is. And many families and individuals have many concerns about the CAS, which I will not go into here. But I think it is also very unreasonable to expect the care manager to be the person to explain the CAS results to the member and family, because they don't know any more about the CAS than anybody else sitting here. Nobody has seen this assessment. Nobody knows. So, for example, you get a report and it gives you an ADL status, but you don't know what the other possible answers could have been for any particular question. So you don't know if it's accurate or not, and neither does the care manager, because the care manager also doesn't know what the other possible answers are. So I want people to be aware that the issue of the CAS is looming as a huge issue, because it is now a requirement for initial service authorization and ongoing authorization for any changes in services for OPW services, including, I think, eventually the PRA budgets for self-direction as well, although not immediately. So this is a very big deal, and it's more something I want to bring to people's attention, and also not to blame the poor care manager as the messenger of what this assessment is, because they have absolutely no control over it, and the best they can do is convey your questions and concerns and contesting any answers on this document to OPWD. That they can do that, but beyond that, you're on your own. And it's a very important issue. And I guess we'll, in the larger council meetings, perhaps we will share some more information about this issue that's basically going to determine the lives of people receiving waiver services for the foreseeable future.
That is an excellent one, especially, Rochelle, for new enrollments. They feel like they were assessed so many times. I just went through a psychological evaluation. I just went through a psychological evaluation, psychosocial, and you came to my home and did an IM assessment, and now I got to do what? It's not fair for the individual and the families to be assessed by so many people, but it is a requirement. One thing that OPWD did do is, if it's changing the waiver regarding providers, there's no need for the CAS. So that's excellent. The fact that a provider is being changed, they don't need to have an updated CAS. That saved us so many times, because what if they don't have a ComHab worker and this provider Z does have? At the beginning, we had to do a reassessment, which delayed months, before that. So that did help them making that change. But if you're adding a new service or new authorization has to be made, you do need a new CAS, and it does delay it. And I think it's good for the families to know from the beginning that the process doesn't end with the approval and then now I get services. So thank you, Rochelle, for that.
Rochelle and Morelli, thank you so much for speaking on that. I'm a previous supervisor myself.
Excuse me, we cannot interrupt in the meeting when the hands are up, please. I'm going to remind everyone, we do follow procedure with hand raise procedure, and interrupting is also interrupting a person who is trying to use the transcript procedure. Caption is available and has to be one at a time. Rose, your hand was up.
Yes, thank you, Chris. So, Angel, we're going to call on you in the order of the hands raised, okay? Just wanted to clarify so that you did have a question. I just wanted to say, Marilyn, thank you. This was a really in-depth overview. As Rochelle just mentioned, it's a lot of information, and yes, care managers came from a long way. There's still a lot, to do, but things are, progressively moving forward. I did wanted to add in terms of the justification. I don't know if you can hear me. Can you hear me, Marilyn? Okay, it looks like OPWD is not approving, just like we were talking about with the CAS system, but they're not approving services as quickly as they used to. So we have a lot of people on the provider side, that are waiting, for approval. And I'm myself thinking about, trying to reach out to OPWD to see if we can have like a presentation there, so family can have that information and learn more, because it is not the care manager's responsibility. The whole is not on the care managers, but a lot of it has to do sometimes with OPWD not approving the waiver services as quickly, as possible. And it's good to know about the CAS assessment too. I'm wondering if that's a topic, right, that we can have here. I'm not sure if that's something we can bring someone here to talk a little bit more about the CAS assessment with families and providers. That could be another future topics that maybe we can have in this committee as well. So, but I just wanted to say thank you. This was a really great presentation. It was very in-depth, a great overview. We have about a minute left. I just wanted to know if anyone else, pass the.
Rose, you do have someone, Rose, this is Chris, I'm sorry to interrupt, but Nunez had his hand up and he's the last one. And then we do have a question. Now his hand is up again. Nunez, you can unmute now and please say your question. And the other question's in the chat. So guys, can you, co-chairs, can you please read that question? And Mira, can you please read your chat in the private section? Thank you.
Hey
Angel, you
everyone,
can go ahead.
apologies on not following protocol. I'm new to this format, and I couldn't find the reaction to raise my hand. But I just wanted to commend Marelli and everybody that's doing care management. I think I see another care manager in the chat because it's a lot of responsibility that is being imparted by OPWD on the role, and also the way the authorizations again that are. The workflow for authorizations that it's being passed down on the manager is exhausting and the family feels exhausted. I was a supervisor myself and I had to kind of step up because I needed to find another way to help families in a more streamlined way. So I just wanted to, again, validate everything that was said here now that is needed, and just say that, everything that was said is completely true, and just thanking everybody that is still doing it, and please keep the great work. Thank you so much.
Thank you. This is Deborah Greif, the other co-chair. I did read the question. It's the same one. You're right, CAS is a major issue. It has not always been implemented correctly. And I'm not going to even go into detail, but the thing is that when you find that it's not been done correctly, besides letting your care manager know, we will find out who you need to contact in OPWDD because of this issue, and it does affect services, and it does then makes the time span even longer. And I'm talking as a parent who has seen many errors. So it is it's gotten better, but it's still not perfect. So I will communicate with the Brooklyn DDRO to find out who we should speak to in reference with issues with the CAS. And maybe we can do a separate, if we can't do it with this committee, the advisory council can set up a special meeting in partnership with the Brooklyn DD Council on issues with CAS and what to do. So with that, I want everybody to know, Rose, to say it's 11:01.
Yeah.
I don't know. I'm looking to see if the chair from the legislative committee, co-chair, is here.
Before that, we have to let everyone know we are ending this meeting.
That's right.
We want to thank
Meeting
you
is
all
ended.
for being on the call. Marialis, thank you so much for your good presentation. Again, the committee meet every second Wednesday of the month. We don't have a topic yet for next month, but we'll keep everyone posted. Just tune in. I'm sure whatever topic we have, it will be great learning experience and great skills and resources and tools for everyone on the call. Thank you all for being on. Marialis, don't forget to share the slides so I can.
I will. Thank you.
Thank you, everyone.
And this is Christopher Greif. Just to remind you, if you're staying for the Legislative Committee, please stay on. Please mute your microphones at this time. We are going to be pausing this in the next second.